There are many great examples as to how this model of healthcare delivery will decrease costs as a whole. So, I think the most obvious answer is the individual patient cost savings. So this is both the direct costs of care, but also the indirect costs. So you're reducing their travel time, their travel expenses, their time away from work. All of that can be factored into how this is saving society, money. And then, on more of a systems level basis, it can certainly provide a more efficient and cost-effective way of approaching care in general. So we saw, for example, Penn did a study in an underserved community in Philadelphia. So you had a lot of patients who were on Medicaid, Medicare, or they were uninsured, and they were able to access a store and forward form of teledermatology that was used in triage. They found that they could reduce the need for face-to-face care for these patients by 27%, or the need for even emergency department visits by 3%. And that emergency department prevention, that's huge, because those can be quite hefty bills and a lot of unnecessary workup that was prevented. The same sort of finding was found in the VA. So they have done a really amazing job of instituting a store and forward triage model. And what this is allowing is serving more veterans from wider swaths of different areas. And you can reduce the need for all of these veterans to come in face to face by, first seeing if their problem or their need can be met by a store and forward visit. And then there was also another study out of UC Davis, which was great. It really showed that just the involvement of dermatologists in the care of a patient can improve outcomes. And it was patients who were referred by a primary care provider to a dermatologist using live interactive teledermatology. And they found that a lot of times the diagnosis from the referring provider more often than not was changed. And so the management plan was changed. And then as a result, they had much better clinical outcomes, and even more so if there was then follow-up of that patient through another live interactive video visit. So if you think about the patient being able to access a dermatologist with using this modality to get the right diagnosis and the right treatment plan, that's going to prevent them going through a number of different, possibly incorrect diagnoses, receiving care that's not really going to be able to help the patient in terms of being able to access a dermatologist so that they can get the correct diagnosis and the correct treatment plan. And that avoids them going through a number of different medications that may not be effective just because they're not receiving the right diagnosis from the beginning. So you can see how all of these models, I think the biggest argument can be made for the ability to follow up with patients with chronic conditions so that their conditions aren't flaring without access, and it can prevent hospitalizations, and it can prevent emergency room visits down the road. Yes, absolutely, and we do run into these scenarios. So I think most dermatologists agree that telehealth is not a means of providing a full body skin exam for a patient. So anatomically sensitive areas, genital issues as a whole for privacy issues are probably best seen in person. Also, if the complaint is, or the image is of something that you probably think is going to be malignant, it's probably best to see that patient in the office and go ahead and be able to perform a biopsy at that visit if at all possible, just so that you're not duplicating visits for the same issue. So if you think, based on your preliminary review, that there's high likelihood that this patient just needs to be seen in person, why do the telehealth visit? Just go ahead and schedule them in person. So I think, and again, it's really important to train your staff on the scenarios where it may not be appropriate, and make sure that you're trying to avoid having those patients scheduled in teledermatology.
Yeah, that makes